We should be live. Just waiting for confirmation. Yes. All right, good evening. This is United Medical ACO Diabetes Program, Wednesday Wellness Webinar. My name is Kemal Erkan. I'm the chairman of United Medical ACO. I'm here with our program members, Donna Gunkel, Director of Clinical Integration, Caroline Weber, one of our dietitians. And also we have a guest for our panel, Dr. Linda Civarelli, who's a podiatrist. So we are going to discuss wound care for our patients who are going through the diabetes and the wound care in podiatric medicine. That's what we are going to discuss. So I'm going to ask our panelists to introduce themselves, and then we'll start after that.
Hi, I'm Donna Gunkel. I am, as Kemal said, the Director of Clinical Integration. So I'm over all of our clinical teams here, including the nurses, the care coordinators, the dietitians, and our social workers.
And hi, I'm Caroline Weber. I'm one of the dietitians for United Medical.
Hi, I'm Dr. Linda Civarelli. I am a podiatrist with Brandywine Podiatry.
Right, thank you. So I'm going to share my screen. So Dr. Civarelli, I'm going to actually give you access with the slide. So let me see if all right. I think you can take over from here.
Okay, I think I see it here. Okay. Yep, there we go. So should I just start chatting, or do you want to introduce Caroline? You want to introduce yourself a little bit more? Kemal, what would you like?
No, I think we can start.
Okay,
Yep.
sure. Okay, so I'm Dr. Linda Civarelli. I am a podiatrist with Brandywine Podiatry. I've been in private practice for almost 20 years now. It's been my great pleasure to serve the patients of Delaware for the vast majority of my podiatric career. Currently, I'm with Brandywine Podiatry, which is a part of the United Medical ACO. I am at two of our, I believe, 7 full-time locations now. Kemal, correct me if I'm wrong on that.
Dr. Savage didn't open another one this weekend, so we.
Okay, all right, good. There's just 7. There's just 7, and one of 11 providers. So we are a large practice with many different podiatrists, and you know, what's interesting is that we have many different varieties of podiatrists. Many people think that all podiatrists do sort of the same work, but we all have our specialties. I'm a general podiatric provider, and we have surgical podiatric providers as well. Today I'm going to be talking a little bit about wound care, and in particular diabetic wounds in podiatric medicine or in podiatry. Just in case you want to reach me, my phone number for our Wilmington office is right here on the screen, and you can also reach us at our website. Okay, so types of wounds. Pretty simple stuff here. Mechanical, these are blisters, corns, and calluses. These are the types of wounds that happen because you have friction. We also see very commonly diabetic ulcers. Diabetic ulcers are very special in that they occur in our diabetic population, and they are responsible for a lot of issues, including eventually, sometimes sadly, amputation. We can also see ulcers that occur because of circulation problems, because of vascular problems. And this usually causes gangrene. And then also we can see wounds in podiatry through trauma or accidents. So we're going to talk today first about diabetic ulcers. Oh, nope, we're not. Today we're going to first talk about mechanical blisters, corns, and calluses. So these are common wounds that happen all across the population. They happen because your shoes aren't fitted well. They happen because you're playing in the pool and you're pushing your toe down on the pool. That's a really common thing that we see, especially in kids. Every summer, everybody knows the tip of the kids' toes because they're bouncing along. Kids can get a little wound there. You can have corns, which occur on the top of the toenail, the top of the toe, because it's rubbing on another toe or on a shoe that's too tight. And calluses, which typically occur under the foot on weight-bearing surfaces. These are just a couple of the more common, very benign things and are generally normal and don't necessarily need to see a podiatrist unless it's causing you a lot of pain or if it's really interfering with your daily activities. You would want to go see someone if you're having pain and it's not going away, or if you have a blister and it's not going away. And I do want to say, none of that counts for a diabetic. For a diabetic, if you have a blister, we want to see you. If you have a corn, we want to see you. If you have a callus, we want to see you. It needs to be addressed. We'll talk about a little bit more about that in a little bit. Okay, so diabetic ulcers. And FYI, I tried to keep this slideshow fairly PG because I know that a lot of these wounds can be upsetting for people to see. And I wanted people to not feel afraid that the next slide was going to be horrifying. So I really did try. I hope I did good enough. So diabetic ulcers are open sores or wounds that most commonly occur on the feet of diabetics. And the reason why they occur usually is for several reasons. One is because oftentimes people with diabetes develop something called neuropathy. This is a loss of protective feeling in the feet. So you may still be able to feel if your feet are cold or hot, or maybe they're itching or the shoe is too tight. That can all still be felt as a diabetic, but you can still have peripheral neuropathy, and that can lead to ulcers. You should definitely be seeing your podiatrist at least yearly, even if you have no complications of diabetes, to be tested for neuropathy. One of the most common symptoms of neuropathy is tingling, numbness, but some people can actually have pain and deep itch, and there's a lot of other symptoms. So if you have diabetes, you definitely want to be screened by a podiatrist at least on a yearly basis. If you have neuropathy, one of the key rules, there's really two rules that I tell my diabetic patients. And if you stick with these two rules, you're probably going to stay out of trouble, even if you have neuropathy. Number one, you should always wear shoes. You always want to wear shoes because you never know what you're going to step on. And if you don't have pain to tell you there's a problem, you may not even know. We think of pain as a bad thing, but pain is really important. It tells us, oh, I've stepped on something. This is terrible. I need to take a look at it. So that's why we encourage all of our diabetic patients, to always wear shoes. Secondly, the other thing we want you to do is look at your feet every day. You should be checking your feet every day. If you can get your foot up on your knee, take a peek underneath, that's all we need. If that doesn't work, you can put a hand mirror right on the ground, right at the wall where the wall meets the ground, and just take a quick peek, or have someone in your family just take a quick peek every day. Okay, so the causes of diabetic ulcers, as I mentioned, obviously diabetic neuropathy is the loss of feeling in your feet, as well as elevated blood glucose, uncontrolled high blood pressure, poor nutrition, and prolonged pressure. And I'm sure that Caroline is going to be talking a little bit more about the poor nutrition piece of this. Okay, let's go to the next slide. All right, so unfortunately, sometimes we also see ulcers that occur with gangrene, and this is due to circulation problems or vascular problems. It occurs when tissue dies because its blood supply is interrupted. It can be caused by an infection or by an injury, or be a complication of long-term conditions that restrict blood circulation. Okay, we're going to go on to the next. Trauma. So these are accidents. We also see wounds because of trauma and accidents. And here are a couple of the different types of wounds that we see. We see high and low velocity blunt trauma, so that's being hit with something large. We see penetrating injuries, that's being, like stepping on a splinter or a piece of glass. Thermal or chemical injuries. Unfortunately, every summer, we see patients who have diabetes, or it's not uncommon in the summer for us to see patients with diabetes who've been walking on the sand without any kind of shoes, and will typically have blistering and burns on the bottom of their feet. That's considered a thermal injury. And then there's something else that we call repetitive microtrauma. So that sounds like a really fancy word, but basically what it means is your foot is sliding around in the shoe and banging into the front of the shoe. So we actually see quite a bit of this repetitive microtrauma where you're just getting like little bang, 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 and it causes an ulceration. Okay. Let's see here. Okay. Prevention and treatment. So I'm sure Caroline is going to be talking about nutritional support and how important that is. Oftentimes when we have patients who have very serious wounds, we'll actually do blood panels on them to see what's going on with their nutrition. Poor nutrition is definitely associated and correlated with poor outcomes and poor healing times, increased healing times with diabetic, all types of wounds. Oftentimes also in a wound care center or in a doctor's office, if you have a chronic wound, you might have debridement, and that's where we would take a scalpel with either numbing medicine if you need it, or not numbing medicine if you don't need it, if you can't feel it, and shave down the extra tissue, so the callus that occurs around there, to encourage the blood supply. Orthotics are really important in this population, so where we're having the foot in a better position so that that little trauma or big trauma isn't happening. Sometimes we'll even make someone completely non-weight bearing, so we call that offloading. We might put someone in a cast or a rollabout to make sure that they're not putting any weight on that foot. Also, there's these wonderful wound vac systems that are really terrific. Oftentimes you'll see in a wound care center or sometimes in your podiatrist office. They go right onto the wound, they apply negative pressure, and it encourages all of this wonderful healing to happen. Sometimes if those don't work, we'll use xenografts. Those are autografts and allografts, and we'll talk a little bit about that. Flowable soft tissue scaffolding and topical wound healing agents. So we'll be talking about that a little bit more in a moment. So let's get into some of these. Okay, nutritional support. Protein. Again, Caroline, I'm sure you're going to talk about that. Protein deficiency is a major factor in healing wounds and ulcers. It's necessary for fibroblast proliferation, and fibroblasts are the building blocks of how we make new cells, and new blood vessel formation and collagen production. And depending on the severity of the wound, the consumption, the last thing.
Did you want me to go back to sharing it?
Would you mind?
I'm sorry, sure, of course. Hold on one second. There we are.
Okay. All right. So where were we? Oh, we were talking about the amount of protein that's generally required, somewhere from 50 to 80, or sorry, from 0.5 to 0.8 grams per pound per body weight per day. So per pound of body weight per day. And very important when we see wounds to consult a nutritionist to make sure that that nutrition piece is there, especially if it's a chronic wound that were having trouble healing. Okay. Let's see here. Next slide. Has to do with vitamins and minerals. Vitamin and minerals play a critical role in wound healing. Vitamin A increases collagen synthesis and wound healing strength, and along with lymphocyte activation, which is helping to make sure that there aren't any bacteria living in and around the wound, which of course make it way harder to heal. Vitamin C increases skin strength and fibroblast content of the scar to make the scar tougher and heal better. Vitamin E is anti-inflammatory, and it decreases as anti-inflammatory. And zinc stimulates wound healing and increases that collagen tensile strength as well. So as you see, these vitamins are critically important. And in a typical American diet, you may not be getting nearly enough of these vitamins. So having a nutritionist, having a consultation with the nutritionist, and having nutritional support is critical to healing these wounds. Okay, so we talked a little bit about debridement. Let me talk a little bit more about that. The goal of it is twofold. One is to remove any pathogens that are hanging out in there. So if you have germs hanging around on that thick skin around a chronic ulcer, that needs to be removed to allow the wound to heal. And of course, we want to remove any necrotic, so any tissue that's died, or any fibrous tissue. And that's like tissue that's not going to turn into a good scar. It's not going to heal the wound. It's just going to sit there and block our progress. There's different types of debridement. You can have a cold steel. That's what's a really cool sounding name. It's what we just mean is a scalpel. We use a rongeur or a tissue nipper. These are all different instruments that your doctor might use. Also, we can use mechanical, and that's using what's called a wet to dry dressing, where we put a wet dressing on and then a dry dressing on top. The whole thing dries. When we remove it, it takes a lot of the tissue off. And then now we have all these enzyme debriders. So enzymes break down tissue and break down collagen, break down these fibroblasts. So wherever we have all this stuff going on, sometimes we use an enzymatic debrider. Oftentimes we're using all of these to help the wounds heal better. Okay. Wound vac system. So it does not look like this. It is a vacuum cleaner, but I thought this is a much better picture than the picture of the wound vac. The wound vac has been around for quite a long time. I'd say maybe 20 years in wound care. It's absolutely standard now. I remember when I was training, it was sort of like newfangled technology, and it was hard to get coverage. But now most of the insurers will cover this because we know that it works. Wounds heal better under negative pressures. That means when there's less pressure and the skin doesn't have tension on it, it actually heals better. So the wound vac system is typically prescribed by your healthcare provider and can be applied either by you at home or in a wound care center, depending on the level of or potentially in a facility. These work terrifically. They promote granulation and tissue perfusion, so they're getting all that good oxygen and all those nutrients down to the wounds, removing infectious material, getting all those gross germs out of there, and drawing the wound edges together. You know, those same thing as stitches, same thing as the little steri strips, it's just holding that wound together. We use this for diabetic wounds, pressure ulcers, skin grafts, and also in infected wounds. Okay. Skin grafts. So autografts. And this is a typical graft where tissue is removed from that person, from the leg, thigh, or sometimes the buttocks of that same person. What also we'll do sometimes is we'll take an autograft, which is from one part of the foot, we'll make an ellipse and we'll move it over and cover up the wound that we have and allow both of those to heal. Okay, so it's kind of replacing like with like. All right, let's see here. Okay, allografts are a different kind. They're not from the same person. They're made from other tissue that's been donated. And these are a couple of the brands that we use. These work really well. They work well in people who have poor nutritional support because you're not taking away and creating another wound. It may not be possible to use someone's own skin to do this. Okay. Lastly, we have the flowable soft tissue scaffold. These are scaffolding materials that we have with all of our wonderful techniques. They create, so it's not tissue per se, it's just to create a scaffolding for our body to create its own wound healing. Okay, so some of the topical wound healing agents we'll often see these are placed by your doctor or by your healthcare provider directly onto your wound and would be covered up and typically are replaced several times a day. We can have antimicrobial dressings. These are dressings that are to keep the germs away. So you might think of something like Neosporin, but we have, this is more like a Neosporin impregnated gauze or other antimicrobial agents. And then we have other gauze and inks. Okay, so the end of this, just a quick recap on what a podiatrist is. It's a doctor of podiatric medicine and a physician and a surgeon who treats the foot, ankle, and related structures of the leg. And this is a little bit about the training. And here is my moment to say that if you are interested in podiatric medicine, please feel free to reach out to me at Brandywine Podiatry. I'd be happy to talk to you about a career. We are always looking for the next generation of podiatric physicians, and I'm happy to find you a mentor, or if you're interested, to meet with you and chat about the profession in general. I think that's the end of my slides here.
Right.
I do have a question though.
Yeah.
We could kind of go back. So I know that you were talking a little bit about some of the, I think it was under the trauma, right? When they're wearing the shoe. So I guess, are there recommendations for someone who is more susceptible, with diabetes, types of shoes that they should or maybe shouldn't wear?
Oh, that's such a great question, Donna, and something that I talk about every single day. Shoe gear is such an important part of the life of a diabetic. It's so critical to be wearing shoes, but it's so important to be wearing the right shoes. If you're wearing a shoe that is ill-fitted or that is rubbing in any way, that can be really catastrophic. For someone who doesn't have diabetes, you get a blister, you put a Band-Aid on it, a couple days, maybe a week later, it's gone, right? With a diabetic, this could spell absolute catastrophe, it could head down the road. So well-fitted shoes are absolutely critical. Medicare generally covers for most of its recipients, as long as they meet certain criteria, diabetic shoes. It can be a little bit of a headache getting them approved and going through all the paperwork, but it's absolutely worth it. These are shoes that are especially designed to have very little, to have lots of room, to have a high toe box. One of the things that we look at in shoes, when you and I go to the shoe store, most people go to the shoe store, we only are looking in one dimension. I'm a size 8.5, and that's just the length of the shoe. I think that shoes should have three different sizes. They should have a length, they should have a width, and they should have a height. And the height is the front of the foot to allow the toes plenty of room. So diabetics should be wearing shoes that are properly fitted in length, width, and height, and hopefully to be wearing some kind of APMA approved or diabetic shoe. These diabetic shoes are available in most podiatrist offices, and they're fitted to you. You also get special inserts that are especially designed to reduce friction, which is another real problem that we talked about within the shoe.
Thank you.
So I guess unless we go through these, or usually maybe one of our family members go through these, we don't understand how important these things are. Just recently, I was back home with my mom, and I always use her as our case study. So she goes through a lot of stuff. She's 70, almost 72, diabetes, hyperlipidemia, and she has these types of issues every once in a while, and it's painful in a way that if they don't understand exactly what they need to do, what they go through is extremely painful. And every time we do these, again, learning is always there. So this was very beneficial from it. Thank you, Dr. Sarali. So we have a couple slides, I believe, from Caroline on the nutrition and diabetes side, right?
Yep.
Yeah. So I'm gonna share my screen again.
Awesome. Well, we already had a wonderful introduction for nutrition, so thank you. It was very helpful. Covered some really good points that we'll kind of glaze over again, which is awesome. Just one more slide.
So it doesn't seem like I can give you access right now. That's what it says.
You can click.
I'll just click through.
There's only like a couple slides. So nutrition, care, and wound healing. It's actually something I'm really interested in because I worked in long-term care for a bit, and I was part of a wound team. And so as a nutritionist, to actually see the wound was super important for treating the wound for nutrition-wise. So that was very educational. And so now it definitely helps me treat patients, especially with diabetic wounds, a lot more thoroughly. So how does nutrition impact wound healing? So often nutrition isn't something I think of like wound. I'm like, ooh, nutrition, right? It's not something people think of the first thing, but it's actually super important to understand the link between poor nutrition and wound healing. Eating well and incorporating enough of the certain foods can help your body heal faster and fight infection. So essentially when the body has a wound, it's in competition for nutrition needs. So wound healing is very energy dependent. Energy is like another word for calories. So if a patient isn't eating well or not meeting calorie or protein needs every day, weight loss typically follows. And when good nutrition is in short supply, the body decides whether to use that available energy to, build new tissue for the wound to use, or to supply it to vital organs, which, like ending of the story, vital organs always win no matter what. So if weight loss continues unchecked, wound healing is impaired, and eventually it'll stop altogether, just to make sure that the body's organs stay intact and well. So the presence of a wound has impacts on nutritional status because of the metabolic cost it takes to repair the tissue damage. In addition to when you have a wound, a lot of the time it can be associated with drainage, right? So we lose a lot of nutrients through wound fluid. So nutrition interventions are super important, and we'll kind of go through those in a bit. But we know that we have an increased rate of healing and fighting infections with good nutrition. And we also know that we have increased nutrition needs. So in general, for extensive or slow healing wounds, your body is going to need more while your wound heals. Each day we try to incorporate and work together to incorporate more varieties of food so we can get all the nutrients like vitamins, minerals, proteins, and things that we'll go over in a bit. And then diabetes impact on wound healing. Biggest thing is hyperglycemia, high blood sugar. So because carbohydrate is the primary energy source for all your cells, including those for wound healing, impaired usage of the carb due to hyperglycemia leads to that decreased wound healing. So chronically high blood glucose can cause poor blood circulation and increase healing time. It can also lead to loss of water and electrolytes, which can negatively impact your wound by decreasing the tissue oxygenation. So we want to make sure we're getting oxygen to those cells to repair. So hyperglycemia and high blood sugar also cause the impaired action of the white blood cells. So think of like your immune system, preventing infections. You have a higher increased risk if we have that high blood sugar. So we want to make sure that this cascade of effects of uncontrolled diabetes is prevented if possible, because having a wound in general, right, it's an inconvenience, but with diabetes, there could be a lot more complications associated, as we've talked about today already. So diabetes and uncontrolled blood sugar have a negative impact on wound healing. So good glucose control helps you heal faster and reduces the risk of your infection. And next slide, please. I like this photo just because it's a good visual and not too gory on people who don't like feet or anything like that. So I think it's really helpful because diabetes with the foot ulcers and those being prevalent, it can be difficult to kind of know when do I get help, right? Obviously, as Dr. Ciavelli said, you get help as soon as you notice, right? Checking your feet every day. So there's specific medical nutrition therapy that we go through to make sure that we're meeting all our needs, even if it's just this tiny little ulcer, right? It affects a lot of people with diabetes, so it's important to pay attention to it. And next slide, please. So what exactly are we paying attention to nutrition-wise? As we said, to heal an extensive wound, we want more calories and nutrients to support that wound healing. And diabetes' influence on the wound healing is complex, multifactorial, and impacts all stages of healing. So initially, we start with the biggest key player, which might be calories. So we want to make sure we have enough energy, we're getting enough calories during our day if we have an extensive wound, or even if a wound is just starting out. The range differs based on stage. So if it's just in the beginning stages, calorie ranges might just be average to a little bit higher than the normal calorie range. But if it's a pretty extensive wound, we go upwards of 35 calories per kilogram. And it's adjusted just based on if you've already lost weight from a wound, those types of things. So we want to make sure that when we get the calories, we're getting protein, vitamins, minerals, which we'll walk through. But wound healing itself is energy intensive, right? And so it demands good calorie intake. We know that one of the main sources of calories we can get is from carbohydrate. So then it kind of stirs some anxiousness. Well, carbohydrates raise my blood sugar and I'm not supposed to have high blood sugar. But there are certain carbohydrates we can focus on because we know carbohydrates are energy dense. They're going to give us good energy to help wound healing. But we want to focus on the certain types. We want to work on whole grains, whole grain breads, brown rices, the skin on potatoes, whole grain pastas, fruits have a lot of fiber in it. Making sure that we get really good sources of carbohydrate that don't impact our blood sugar as much as a white refined grain, and limiting those refined and added sugars because those tend to cause some inflammation and can promote some bacteria growth. So making sure that we choose the right kind and monitor our portion size, right? So we don't want to go, I have a wound, let me eat a whole plate of pasta. We don't want that. We just want to include a good source of carbohydrates and portion sizes with the right type of carbohydrate to support good blood sugar. So we often run into, back one slide, sorry. We often run into sometimes, especially with if you have an infection or you might have a fever or something like that, appetite kind of goes down. If you're just not feeling great, you don't want to eat, or maybe you have a small appetite to begin with, you run into trouble, well, am I eating enough? So there are certain things you can work with a dietitian to kind of tackle eating, healthier snacks multiple times a day, energy dense foods to eat, small meals more often. And then we can even go into supplementation eventually, like if it calls for that. But it is important to consult a dietitian if you do have a poor appetite and you're not able to get the calories in. The next one we'll talk about, which we already mentioned, is protein. Oh, sorry, back one. I go on a whole list on this one. So protein, and we'll just preach protein till the end of the days for wound healing because it provides the building blocks for your muscle and skin to repair. So your protein needs are actually really dramatically increased depending on the stage. I know we mentioned pounds when you were going over it, but I did kilograms because what I'm used to. But 1.2 to 1.5, if the wound is extensive, you're obviously going to need some more protein. So patients can experience wound drainage, which a lot of protein is lost through. So consuming adequate proteins allow us to maintain that optimal nutrition status and prevent, an overall decline. So usually it looks about like 3 to 4 servings per day. One serving is about 3 to 4 ounces. So think of like a 3 to 4 chicken breasts a day, if that is a good visual. But good protein sources can come from everything. So like a lean animal protein, chicken, fish, turkey, beans, lentils, tofu, peanuts, peanut butter, seeds, even like the cheese, cottage cheese, those are really good energy dense foods. Even sometimes milk or milk alternatives are great protein sources. There are protein supplements, which we'll talk about soon, but if it's recommended by your provider, Definitely can talk more in depth about that if you can't physically get the food into you. So also we do make sure that we work with the dietitian, especially if you have kidney disease. We want to make sure that that protein is being monitored. So this 1.2 to 1.5 doesn't apply to everybody. It's obviously individualized. So definitely consulting your providers before, making these big jumps on protein. And then the next one is fluid. Fluid, not the first one you focus on, but if you're having wound drainage, you're losing fluid. So increased fluids might be necessary, especially if you have a fever, you're vomiting, you're sweating, you have an infection. We want to make sure we're getting you proper hydration because all of your body functions off of hydration. So also to note, if you have a fluid restriction, obviously don't bump up your fluid without consulting your doctor. You want to make sure that we get enough fluid to keep you hydrated. But there's certain recommendations. Some doctors say drink half of your body weight. We normally say, 30 milliliters per kilogram. That might look like, I guess if you weigh 175 pounds, take into kilograms. So 79 kilograms times 30 milliliters would equal about 2,300 milliliters or 70 to 80 ounces a day. So kind of getting that hydration going, making sure that you're staying hydrated. And then we kind of already reviewed vitamins. So I got the easy part here. Basically all of the above what we said with vitamin A, C, E, and zinc. They help fight infections, repair tissue damage, keep skin healthy. Some food sources, obviously we can't always get them all the time from food or eat enough of it to get a good amount, but some food sources for vitamin A, you could find, leafy greens, cantaloupe, apricots, carrots. Think of like some orange foods, cheeses, eggs, liver. If that's your thing, you could eat liver and that'd be a great source. And then vitamin C, I think most people are pretty familiar where to get some vitamin C, citrus, bell peppers, strawberries, tomatoes, some really good fruits and vegetables. Vitamin E, you can get it from olive oil, sunflower seeds, almonds, peanut butter, green leafy vegetables. And then zinc is found mostly in animal foods. So eggs, fish, beans, and lentils, meat and poultry, seafood, and even in some whole grains as well. So we also know there are some other nutrients out there that do help wound healing. We know iron is important because it brings oxygen, it requires for oxygen transport, and B vitamins for protein synthesis. So we know the whole recap is we need a good variety in our diet to make sure we get all the vitamins and minerals we need to support good wound healing. Unfortunately, there's no research about higher doses of vitamins and minerals. We don't have evidence-based guidelines on the specific micronutrient amounts to recommend to promote wound healing, mostly because that research is fairly expensive to complete. So it's difficult to obtain minimum amounts of zinc and vitamin C from foods, especially if we don't have a wide variety of fruits and vegetables and products in our diet. So usually with physician approval, normal recommendations might be a multivitamin plus 25 milligrams of zinc, maybe additional 500 milligrams of vitamin C. If there's no history of kidney stones, consulting a physician is probably the best way to go to make sure that you're getting a good amount, especially for your current needs, right? If you run a vitamin panel and those types of things. And then I think I'm ready for the next slide finally. All right, so what if we can't get these nutrients from food, right? So what if we're having difficulty eating enough to make sure we're getting the proper nutrition for wound healing? I always like to recommend food first approach. Usually it's preferred for most patients. I would prefer to eat food rather than drink a boost just for taste preference, but it's also cost effective. A lot of the supplements out there are pretty expensive at times. I know insurance will cover them under some circumstances. But we want to make sure that we can offer the food first approach, give all the options for protein and calorie intake that we can before turning to supplements. But supplements might be required to meet calorie and protein needs in some people. So that could be homemade protein shakes, high calorie protein shakes, like a commercial formula, such as Boost, Glucerna. Obviously, if we have diabetes, we want to go for the sugar carb steady ones. So like the Glucerna. I know Premier has like 1 gram of sugar, and there's all different kinds of commercial brands that have a diabetes friendly nutrition shake. So it's always recommended to consult your physician too, especially if you're going further in the supplement route to amino acids. So if your wound is extensive, you can probably switch to the next slide. If your wound is extensive, either a dietitian or a physician might recommend amino acids. So amino acids are the building blocks of protein. So they're responsible for collagen, connective tissue synthesis, multiplication of cells, and even proper inflammatory responses. So arginine is one of the ones you hear of most often. It's an amino acid that supports the blood flow in the building blocks of protein. So it normally is produced in adequate amounts in the body, but stress and illness may increase amounts of arginine or may require increased amounts. So calorie and protein intake must be like the first priority, and then arginine is important for the wound healing process. So to help increase blood flow and oxygen to the wound, and then it results in increased collagen formation and reduced inflammation. So overall better wound healing. So patients with like an on the fence marginal nutrition status and intake might benefit from these supplements, but there's no established guidelines. Again, no one's really put in the money or time to study, how much of it should we be getting. Glutamine is the other one. It's an amino acid that plays a role in production of collagen, the main structural protein that we found in our skin, and then other connective tissues, and it helps support the immune system. And the one that I don't hear this as regularly as the other two, but HMB, it stands for, make sure I say this right, hydroxy beta methyl butyrate. I could have said that wrong. But HMB comes from the amino acid leucine. So HMB is a compound found in small amounts in the body. And it's found in certain foods, like the really random foods like grapefruit, alfalfa, and catfish. So if you eat those regularly, you're probably good. But HMB helps produce new tissue by slowing down that muscle breakdown, enhancing the protein synthesis. So it helps reduce inflammation, protecting your muscles from damage, and it works to keep the body's muscle cell walls strong in order to protect the muscle from any stress-related damage, right? So I like this picture because that makes it real simple. It shows you exactly what each amino acid is doing and how it helps. So below you'll see two supplements that I use pretty frequently when I worked in wound care. So Juven is the one we use more often, mostly because it had usually better research associated with it. But it has zinc, vitamin C, E, and B12 in it as well. It contains the arginine, glutamine, and HMB. So if your doctor or I would recommend a supplement, these would usually be maybe some of the primary ones, mostly because it's diabetes friendly, right? It has like 0 carbohydrates, and it has 15 grams of protein per serving. You mix it in your drink. So the micronutrients involved may aid improving immune response, skin integrity, boosting collagen synthesis. So overall, it'd be a good route if you have, some nutrient deficiencies and are having a prolonged wound healing issue. And next slide. So yeah, overall summary. Obviously, wound prevention is like our main goal. We want to make sure that you don't have a wound. We want to have good glucose control, preventing high blood glucose numbers. We want to have a balanced diet to make sure we have no nutrient deficiencies, and then routine checkups, making sure you're seeing a dietitian for help, for dietary help, you're seeing podiatry, making sure you're going to all your routine checkups, because that's really a great way to prevent any wounds from coming about. And then prompt treatment. So if you do have a wound, get in contact with your podiatrist, get in contact with a dietitian. Optimal calories, protein, fluids, vitamins, minerals are all essential. And there's a lot to keep track of. So we definitely help with that. And then frequent reassessment. So sometimes wounds worsen and it just happens. So prompt reassessment for changing your nutrition care plan. Sometimes we might need to adjust some nutrients. So overall, see your providers. We work as a team for a reason. And that is it on my end.
That's Joshua saying it's time to play.
Look, you have a diabetes. Come on. All right, guys. Well, thank you so much again. Donna, you may want to take over a little bit.
Yes, I will. So we do want to thank both of you for participating tonight. I think it's very good information. And again, we do try to we try to get a lot of information out there to our patients. So it is a reminder, Dr. Civarelli and Caroline, to pass this along to your patients to let them know that we do have these resources out there for them. So I know you said you were having trouble, and unfortunately, I don't think I can unmute you. But thank you. Have a great evening, everyone.
Thank you, everyone. So
thank you.
Joshua says hi.
Right.
Okay, bye-bye.
Good night.